About since I was born. So when I was born, there were some underdeveloped neurons in my brain, and they kind of slowly scarred over. And so every now and then, those neurons would sort of irritate my brain in such a way that seizures are basically an electrical storm in your brain. So, when they got irritated in that particular way, I would have a seizure. That electrical storm in my brain would happen, and so that's kind of how my seizures happened. Yeah, so different seizure patients will have certain quote unquote auras, which are this feeling of like, oh gosh, I'm about to have a seizure. And auras can last anywhere from like 10 seconds to a few minutes. So mine were about ten seconds before I go into a seizure. I would have this just sense of like, oh no, something's not right. And then I would slowly start like, because my neurons were on the right side of my brain, so I would start like drifting to the left and like shaking and everything, and then a few seconds later I would go into a full blown catatonic seizure. During the seizure, I don't really know what it feels like because I'm unconscious, but I can tell you what the aura feels like, which is it's basically you literally feel like you're about to die. And that's not really completely unwarranted because I believe it's about 1 in 1,000 people with seizure disorders do in fact die from what the CDC calls SUDEP, which is this clever way of saying sudden unexpected death by epilepsy. Mostly, it really hasn't affected my life in a negative fashion. If I have a seizure, then I'll just take when I was like running for App State, if I had a seizure, I would just take a day or two off from running and then get back going at it. But for me, the hardest part by far was not driving. It depends state by state, but in North Carolina, you have to be seizure free for 6 months before you're allowed to drive. And if you have a seizure again within that 6 month time frame, the clock starts back down to zero. So before my surgery on October of 2018, I had not driven for about 2 years, which is it's just hell. The main treatments are just medication, just trying different medicines at different doses. And for me, I had tried and failed about 7 different medicines. And prior to my surgery, I was on 3 different very powerful medications, anti-epileptic medications. And even then, I was still having seizures. So some people are able to control their seizures very well with just a few medicines. Other people, it's just a lifelong endeavor to find that quote unquote perfect mix. I have not had a seizure since my surgery. Absolutely. If you've talked with your doctor and have failed several different medications and feel like that might be the best route for you, absolutely. Without a shadow of doubt, I would unequivocally recommend surgery.